Greetings, my friends. This is Dr. Jaime, and today I want to share with you an overview of Hidradenitis Suppurativa. Hidradenitis Suppurativa, also known as acne inversa, is a chronic, non-contagious inflammatory condition characterized by a pimple-like bumps or boils and tunnels or tracts on and under the skin. Pus-filled bumps on the skin and hard bumps beneath the skin can progress to painful, inflamed areas, also known as lesions with chronic drainage. Hidradenitis suppurativa starts in the hair follicles in the skin. In most cases, the cause of the disease is unknown, although a combination of genetic, hormonal, and environmental factors likely play a role in its development. The disease can significantly affect a person's quality of life. Hidradenitis suppurativa affects an estimated 3 women for every man and often appears around puberty. Having a family member with the disease increases the risk of developing hidradenitis suppurativa. An estimated 1/3 of people with hidradenitis suppurativa have a relative with the condition. Smoking and obesity seem to increase the risk of developing hidradenitis suppurativa. People who are obese tend to have more severe symptoms. The disease cannot be spread from one person to another. Poor personal hygiene does not cause hidradenitis suppurativa. In people with hidradenitis suppurativa, pus-filled bumps on the skin or hard bumps beneath the skin can progress to painful, inflamed areas known as lesions. They have a chronic drainage. In severe cases, the lesions can become large and connected by tracts, narrow tunnel-like structures beneath the skin. In some cases, hidradenitis suppurativa leaves open wounds that won't heal. The disease can cause significant scarring. Hidradenitis suppurativa tends to occur where two areas of skin may touch or rub together, most commonly the armpits and the groin. Lesions may also form around the anus, on the buttocks or upper thighs, or under the breasts. Other less frequent sites of lesions may include the nape of the neck, the areola of the breast, the scalp, and the area around the navel. Some people with relatively mild disease may have just one affected area, while others have more extensive disease with lesions in multiple sites. Skin problems from hidradenitis suppurativa are usually symmetrical, meaning if an area on one side of the body is affected, the corresponding area on the opposite side will be affected as well. Hidradenitis suppurativa begins in the hair follicle in the skin. The cause of the disease is unknown, although a combination of genetic, hormonal, and environmental factors likely play a role in its development. An estimated 1/3 of people with hidradenitis suppurativa have a family member with a history of the disease. The disease seems to have an autosomal dominant pattern of inheritance in some affected families. This means that only one copy of an altered gene in each cell is needed to cause the disorder. A parent who carries the altered gene has a 50% chance of having a child with the mutation. Researchers are working to identify which genes are involved. An early diagnosis and treatment of hidradenitis suppurativa is important both for managing symptoms and reducing the development of new lesions. The diagnosis can be done by examining the skin for pores in locations that are characteristic for the disease. Laboratory tests or fluid from the lumps and blood tests may occasionally be performed to rule out other diagnoses. About the treatment for hidradenitis suppurativa, it is individualized and targeted at reducing the skin lesions and preventing the progression of the disease. Options will vary depending on several factors, including the severity and extent of the lesions and possible complications. A class of medications, known as biologic, is approved for the treatment of moderate to severe hidradenitis suppurativa. Other medications used in the management of hidradenitis suppurativa include antibiotics, corticosteroids, immune suppressants, retinoids, hormone therapy, and approved treatments for other medical conditions. Laser hair removal may also prove beneficial. Some patients take medications to manage pain associated with the disease. Psychological counseling may be helpful for people dealing with the emotional effects of the disease. In addition to the treatment that you may have been prescribed, you can do several things on your own to be more comfortable and, in some cases, minimize lesions, like keep areas clean, using ordinary soaps and antiseptics, maintain a healthy weight, quit smoking, wear comfortable clothes, use warm compresses. Some people with hidradenitis suppurativa find it helpful to work with a mental health professional or participate in a patient support group. Other strategies such as yoga and meditation may also help to improve quality of life in people with the disease. Well, I hope you enjoyed this episode and we will see in the next one. Thank you.